my channel. This is Priyadarshini. I hope आप सब ठीक हैं. In this video, I'll discuss about the transmission of coronavirus through air. Previously, I have made videos on coronavirus and the link is in the description box. Infectious agents of diseases like tuberculosis, measles, chickenpox are transmitted through air. Similarly, respiratory viruses like influenza, SARS coronavirus, MERS coronavirus are also transmitted through air. On 9 July 2020, WHO, World Health Organization, have updated that the SARS coronavirus 2, which is responsible for causing COVID-19, is also transmitted through air. According to the scientific reports published in Nature, the respiratory droplets 5 micrometer are called as droplet nuclei. Airborne transmissions occur when the infectious agents are spread by dissemination of the droplet nuclei. The physics of exhaled air and flow physics have generated the hypothesis on possible transmission of coronavirus. This hypothesis states that first, the number of droplets produce droplet nuclei through evaporation, and the second is when breathing in and out we produce exhaled aerosols, and when this is inhaled with sufficient of amount of virus in it, the person gets infected. However, these are just possibilities as there is no proof yet. According to Julian Tang, a virologist from UK, the University of Leicester, the major problem faced by the researchers is when the device is used to suck the air sample, the lipid membrane which is covering the coronavirus gets damaged, and the recovery is low when it is cultured. The researchers from US has also told that the viability of the virus in air depends upon the environmental conditions. It is when the smog saliva is exposed to summer sunlight for 6 minutes, the viability of the virus is lost by 90%. And when the same is placed in dark, it gets the same loss of viability in 135 minutes. And it is also proved that the UV lights have greater impact in inactivating the virus. From all this, we can guess that there is greater risk in indoor environments.
The Singaporean study found the air sample in 2 to 3 patient infection isolation on rooms with samples in the 1 to 4 micrometer and more than 4 micrometer size ranges containing a range of viral loads 1.8 to 3.4 viral RNA copies per liter of air. The study of Nebraska, USA point that 63% of air sample were positive with a mean viral load of 2.9 copies per liter, including in patient rooms and the hallway air. Aerosols are more likely to be produced by talking and breathing, which might even constitute a bigger risk than sneezing and coughing. When someone's coughing, they turn away, and when someone sees sneezing, they also turn away, but it's not the case when we talk and breathe. A study of people with influenza found that 39% of people exhaled infectious aerosols. As long as we are sharing the same airspace with someone else, breathing in the air that they exhale, airborne transmission is possible. If you are breathing aerosolized virus, we don't know what the infectious dose is sufficient to infect us. Though whatever the infectious dose is, length of exposure is probably an important factor too. Each breath might not produce much virus, but if you are standing beside who's infected, sharing the same airspace for 45 minutes, then you are going to inhale enough virus to cause infection. Until effective treatments or vaccines are available to reduce the effective number of less than 1.0 and stop the ongoing COVID-19 pandemic, enhanced ventilation may be a key element in limiting the spread of SARS coronavirus 2. These are few key ventilation associated recommendations. The first is to remind and highlight to building managers and hospital administrators and infection control teams that engineering controls are effective to control and reduce the risk of airborne infection. The second, to increase the outdoor air change rate and enhance ventilation effectiveness using existing systems. To eliminate any air recirculation within the ventilation system so as to just supply fresh air. To avoid overcrowding, example customers at every other table in restaurants or every other seat in public transport. To supplement existing ventilation with portable air cleaners, which is with mechanical filtration systems to capture the airborne micro droplets.
If the recommended building related measures are implemented correctly, then we can reduce the concentration of pathogens in air and hence stopping the spread of virus in air. It's not only for coronavirus, it can be used for other pathogens in future. We usually emphasize on hand hygiene, social distancing, quarantine, isolation, but we should also emphasize that the engineering controls can be used to stop airborne transmission. It can be used in public places, hospitals, and we can protect our healthcare workers, public. So this was all about the airborne transmission of coronavirus. If you like my video, please like, share and subscribe, and do not forget to hit the bell icon. Thank you.